Hi everyone, my name is Hannah and I'm an occupational therapy student. I will be presenting on health and wellness. So some topics of this presentation today are physical activity, exercise, and energy conservation. Throughout this presentation, I will also have some examples and tips, and then some questions for you to think about as we discuss as well. So starting off with a question here, just seeing if you know what the difference between physical activity and exercise is. So go ahead and take a moment to think about the difference between the two. So now I'll get into the difference. Starting with physical activity. Physical activity are the tasks that we do each day that get us moving. So some examples would be housework. Through doing housework, we are getting physical activity in. And so some examples would be vacuuming the floors, washing dishes, folding laundry, dusting, sweeping, mopping. Some yard work examples would be if you were push mowing the grass, raking, shoveling snow, watering flowers, doing any gardening, things like that. These are just a few examples of physical activity. But by actually doing the things that we need to do each day, we are receiving health benefits from. And then exercise is the extra activities we typically don't do as part of our daily activities. It's more of the extra things that we do, such as running, lifting weights, swimming, biking, and participating in sports activities. Again, this is just a few examples of what exercise is. And then, so here I have a way on how to remember the difference. So with physical activity, that's the things we do each day, such as chores. And then exercise is the extra things that we do. So if we say we're going to go work out, things like that. And the way I really remember exercise and what it is through the underline that I have there under exercise, the EX, and then the EX and extra as well. So exercise, extra things. So here I want to talk a little bit about the exercise that is being done by participants at the American Stroke Foundation. So we do morning muscle moves, which are different stretches, strengthening exercises, and balancing exercises. We have the new step machines, which is here in this picture on this slide. We have aquatics, so the exercises that are being done in the pool, the athletic trainer that is available to help with exercising, and then walking on the track as well. So some exercise resources, OT and PT home exercise programs. So if you've had a stroke or if you've ever received occupational therapy or physical therapy, sometimes, most of the time, they'll send you home with a home exercise program. And it may sometimes kind of look like this picture that I have here, but they give you those as a resource to use while you're at home, so you have something to refer to. So if you have one of those laying around, you could get that back out and do some of those exercises. And then athletic trainers are a good resource. They are specifically trained to help you with those things, so they are great to go to. And then YouTube videos. There's lots of videos out there on exercise that you can look up. For the American Stroke Foundation, if you go to their website, American Stroke Foundation, and then scroll, you will see that there is a YouTube channel link. It'll be the YouTube logo. If you just click that, it will take you to the American Stroke Foundation's YouTube page. On there are some exercises that you can refer to. And then also referencing this picture that I have here is just something that you can pull off of online. They have lots of templates and examples with pictures and wording as well, like this picture that I have here. So meaningful exercise. Exercise is not something that everyone loves to do, but if we make it meaningful, it can have, or we can make we'll be more likely to want to do it if it's something that's important to us. So exercise where and how you want to for a more meaningful experience. So some examples that I have are if you would rather exercise indoors, do that, or the opposite. If you want to be outside, go and work out there. Indoors, you can work out in a gym, you can work out in your home or wherever you want. And then what also can make exercise really meaningful is if you are with another person or group, someone that'll just make it a more fun experience and overall more enjoyable. Or if you'd rather just exercise by yourself, then do that as well. So here I just have some pictures based off of the things that I was just talking about. So up on this top left picture, we have maybe someone's living room, and maybe that's a space that they really enjoy, and that natural lighting coming in from the windows is something that makes them happy. So having that open space as well is also really important for exercising. Again, exercise with a group of people, or maybe exercise by yourself. This next picture that we have on the bottom left is just a big grassy area that's open and probably a good place to get some sun and fresh air while exercising. So if that's your style, opt for something like that. And then bottom right picture, I just have a gym picture there that has equipment and just an area that is conducive for exercise. So think about what your style is, or try out different types, see what you like the best, and then try to stick with that, because that'll make it a more meaningful experience for you. So now I want to get into talking about exercise intensity and time per week. So for health benefits of exercise among adults, the Centers for Disease Control and Prevention recommends this: moderate intensity exercise for 150 minutes per week. So an example of moderate intensity exercise would be going for a brisk walk. For vigorous intensity exercise, they recommend 75 minutes per week. An example of vigorous intensity exercise would be running. Now, there are a whole bunch more things that go into both moderate intensity and vigorous intensity. Those are just two examples that I have. But going back to the 150 minutes of exercise per week for moderate intensity may sound like a lot. But if you break it down into 30 minutes per day, 5 days a week, it's more split up. And either way, you're getting those 150 minutes per week. So it may be more doable for you. And you could also break it up into more than 30 minutes a day for less days a week, just whatever works best for you. And then with doing more time than recommended, they say that you will also have further health benefits as well. So know your limits. Everyone is different. Recovery from a stroke looks different for everyone, and exercise will look different for everyone as well. So know your limits, know what works best for you, and stick with that. Don't compare yourself to others. And no one's journey is the same. So exercising, same thing. And then rest. You don't have to exercise every single day to receive health benefits. Physical activity in itself has benefits. By doing the things that need to be done, you're also receiving health benefits. So again, doing your chores, doing yard work, all those things, that's physical activity. You're still having health benefits going on inside of you. So take at least one day off from exercise each week, if that works for you, just to let your body heal, because like our brains need rest, sleep, our body does as well. And it's important that we do that so we can continue to keep going, because if we get run down and too tired, then it's just going to keep going on and we're not going to get anywhere with that. So we need to sometimes take a break and rest. So now I want to get into exercise benefits a little bit here. Some of the things that I have listed are benefits for our brain, heart, our mental health, overall health in general. Exercise can decrease your stress and anxiety if you experience those. It can leave you with mental clarity. You'll increase your muscle function and strength. And there are so many others, but that could be its own presentation. So I'll just leave it at that for now. So now talking about exercise and the muscles themselves. So muscle atrophy. What this is a decrease in muscle tone, size, and strength. This can occur when we don't use our muscles. This can happen when we have a stroke. It can be a result of not exercising or lifting weights. And it is a natural result of aging. As we get older, our muscles tend to atrophy just a little bit, and this atrophy can happen to all muscles of the body. So here I have some pictures of muscle atrophy. So here on the far left, we have a normal muscle. And then if you compare that to the picture right beside it, it's a atrophied muscle. And the difference between the two pictures is that the atrophied muscle is smaller. Again, on the right, same thing here, just a little bit different. If you look at the left versus the right, that picture of the muscles, they're larger, they're more defined. If you look at the chest and stomach, they're more toned, whereas on the far right picture, the muscles are smaller, the chest and stomach are not as toned, and they're sticking out just a little bit more. So that's the difference between your typical muscle and an atrophied muscle. So consistency. Just a note on this to be consistent with exercise, because that's how improvements occur. It's how we notice our changes. And so here I have a couple examples. First, starting with inconsistent exercise, an example of that. So for example, if you take a week off of the new step machine or exercise in general, and then you participate again, later on afterwards, you may feel soreness. So the opposite example of that is to be consistent. So if you do the new step machine regularly, and then after time, you increase your resistance, you may still feel potential soreness. However, the difference is that when you increase your resistance and you feel soreness, more than likely it's because you're seeing further improvement in your muscle function and strength. So examples there for the difference between being inconsistent and consistent, and what the soreness can mean with those. Just a little side note here on positivity. With exercise, you can look at it this way for a more positive outlook on exercising. So this quote here that I have to exercise, and changing that to, I get to exercise. So that can make it a little bit more meaningful as well, if you look at it in the way that you don't have to do it, but rather you get to choose to do it, and you and your body are capable of doing it. So sometimes I like to refer back to that, and hopefully you will as well now. Okay, now moving on to energy conservation of the body. So I want you to take a minute and just think about, what is this? What is energy conservation? What do you know about it? So energy conservation is completing activities in different ways to maintain your energy and reduce fatigue. A couple more questions here for you. How have your energy levels changed since having a stroke? How does this affect everything you do? Take a few moments to think about that. So here I have some things that are common after having a stroke. After having a stroke, one side of the body may be more affected than the other. Now looking at that in a different perspective, that's roughly half of your body weight and strength not working with you. This requires you to use more energy to do the things that you would already be doing, except you don't have your whole entire body working with you. So you're using more energy, and that can make things more difficult. So why is it important to conserve energy? Well, it allows you to do more things because you will have energy stored or rationed. So if you have energy stored or rationed, you will be able to go longer during the day. You'll be able to do more things later into the day. So here I have a few ways on how you can conserve energy. Take breaks frequently throughout the day. You don't have to do everything at once, say like at the very beginning of the day, and then rest the remainder of the day because you're too exhausted to do anything else. So what I recommend is doing 1 to 2 tasks, depending on what they are, then rest, and then continue to repeat that pattern throughout the day. So do smaller tasks, take a break, do smaller tasks, take a break. Just continue that throughout the day rather than doing everything at once, because you're going to just use up all your energy and you may not be able to do anything else the rest of the day. So ways to avoid this would be to plan ahead of time, ways you can simplify the things you already do. So an example I have with that is taking less trips up and down the stairs or back and forth between rooms. A quick note though, for the opposite of this, if you're not too worried about conserving your energy and rather you have enough energy and want to challenge yourself a little bit more and work harder so that you can continue to improve, would be to maybe take a couple trips up and down the stairs extra than you would already do. So of course, this is going to vary for each person and it's just where you're at. But just wanted to throw that in there as well. So here I have a couple more examples of energy conservation through the activities that you do. So sitting rather than standing when exercising. So my example with this is morning muscle moves at the American Stroke Foundation. Sometimes we do these seated. So we're able to work out our arms, our core, our legs, all while sitting down. So these things could be done standing, but by sitting, we're not using all of our muscles. They're not all firing to keep us standing up straight. When we're sitting, we're giving our legs a break. So that'll conserve some energy. Another example would be to have someone else carry heavy items for you when walking long distances. Now, I'm not saying to have someone carry items for you all the time, but if you are walking farther, or if you are carrying something heavier or a lot of things at once, you may just ask someone to help you out there, and that'll help you conserve your energy as well. So energy sources, again, rest. So physically letting your body rest, also sleeping, letting your mind and body rest at the same time. And then of course, food and water. Without food and water, our energy levels decrease because we're using what we have stored up already. And so we need to replenish all that energy with food and water. We also should regularly eat nutritious foods and drink lots of water to stay hydrated. And that is all I had for that today. So if you have any questions, please let us know. And here's just a reference for the Centers for Disease Control and Prevention that I referenced in my presentation. Thank you.